Hello. So today I am interviewing Dr. Fania Mela, who is Associate Professor of Medicine at Harvard Medical School and Director of the Pacemaker and ICD Clinic and the Lead Management Program at the Massachusetts General Hospital. In addition to this, she has three lovely children and has taught and helped and been supportive to many, many fellows who have gone on to become big names in their own right. So welcome, Fania Mela.
Very nice to be here. Thank you for inviting me.
And I should add that in addition to this, she is a very great friend of mine. So, Fania, I want to ask you about the things that you think are important for becoming successful in cardiology, both in general and if there's anything in specific that you would say for women in cardiology is important.
So I think not only for cardiology, but in general, to be successful, and there could be a whole other discussion about what successful means. The priority, the most important thing is to really like or even love what you do. And I think this is what gives you the strength and the discipline to be successful. I was fortunate, I think, to early on decide that I wanted to spend time in cardiology. So right after medical school, I knew that I wanted to do cardiology, so I didn't really have to spend a lot of time thinking about different specialties. And what I was also fortunate to have during my early years is meeting people that inspired me to really love what I was planning to do even more. So time has proven that it was the right decision. But I think in addition to loving what you do, you also have to invest some significant time and effort to be good at what you do, to create relationships with people in the field, to offer help and get help from, and to really be able to study and analyze the information, new information, knowledge, data, to really be as thorough as you can be in the field that you end up working in.
Wonderful. So I would like to pick up on something you said there. So you were saying that there were a number of people who kind of inspired you, and I, remember back in more or less the same time period that there were very few female role models. So these people who inspired you were in cardiology. I mean, you can get inspired outside of cardiology, but there were very few. Did you have a particular mentor, and were any of your mentors female?
Actually, my early mentors were all males. I think growing up in a family with an older brother and going to school and having a lot of friends that were male, and also the society in Greece, I come from Greece, as you know, um, would although it was still a patriarchic society, you would, during the time that I was growing up, women were finding a role in the workforce and in the society. So I did not specifically feel that I did not belong into the group of people that I ended up working with, even if 90% of them were males. So I did not specifically look for a female mentor, but I was just, one of the young physicians that would get inspired by the person that would explain the difficult EKG, or would explain an ablation procedure and the magic behind treating tachycardia that today we consider bread and butter, but really helping a person have improve their lives. Later, though, I would say even after practicing for 10 years or so, I came across with a great group of women leaders in the field. And there were a lot of role models of very energetic, very smart, and dedicated women that would also pay attention to the support of other women in the field, which was something that I had not necessarily done systematically up to that time. So I speak about the Women in EP group that has taken multiple forms over the years, and there were particular 2 or 3 women that were really great role models and supporters actually to this day.
Wonderful. So, do you think that there were perhaps even some advantages to being a woman coming up, being successful?
Um, I do not like to necessarily differentiate colleagues by gender. Um, I think we are all in this patient care field for something that we love to do, and gender does not necessarily play a role. I have seen different styles between women and male practitioners.
Mm.
I recognized myself like caring deeply about the patient and not the case, which is not always what happens in our field. Um, I have had no bad instances or times that I felt unsupported because of my gender. I think I was also lucky to live in a quite progressive, I want to use the word, area of the United States. And so I always felt as one of the people in the lab or in the clinic or in the department rather than a female in the department.
So, were you never told along the way by anyone that, oh, you shouldn't bother to go into cardiology or electrophysiology, or you can't do those things and have a family? Did nobody ever say those things to you? Because they've said that to a lot of other people I've been interviewing.
I can only recall my mother telling me that I should become a dentist so that I have my office next to my house, so I can keep an eye on my kids. When my mother didn't even know if I was going to ever have kids. No, actually, I did not. Maybe I did not allow room for advice like that
Mhm,
because I really knew what I wanted to do. So it wasn't not a matter of asking whether to do it.
mhm.
It was more about what is the best way of doing it. So I think I felt quite determined so early on that I was never I never encountered any comments like that.
I think that's a wonderful piece of advice to just know what you want and not even seek advice about that sort of thing. Well done. Okay, so what attributes do you think that you bring to a team that has helped to make you successful?
Um, I believe it's the devotion and the determination of getting things done the safest and best way for the patients and the team. I want to believe that I am a good team member, and I think that can take someone a very long way. understanding the people that work with you, not necessarily only physicians, like everybody in the room, everybody in the lab, everybody in the whole hospital, makes relationships positive and more efficient for the overall result, I think. So I have been called the voice of reason when I would be probably the most uh, relaxed about making decisions rather than panicking or making quick decisions. But I really feel that it is my desire to bring people together as a team and make things happen in the best possible way.
So you've already made it very clear that you knew very clearly that you wanted to be to do cardiology for a long time. But did you have a clear vision of, how everything was going to pan out and what you were going to do and where you were going to get to? Or is it just a question of jumping at any opportunity that comes along?
My early vision was to practice in my home country. I had never thought that I would be practicing so many thousand miles away. So I have to say that I am not the kind of person that makes 20-year plans and sticks to them. I do like taking opportunities, but at the same time, I feel that I am very loyal and I prefer to to keep fighting to improve the present situation rather than keep jumping from place to place to place. The proof is that I have been at Mass General, as you know, as an attending since 2000, so almost 25 years. Um, and this was part of the plan to find a place that when I go to work every day, I feel happy that I go to work. So that might have been really the long-term plan, and once I found it, I just stayed with it.
Mhm. So, can we talk a little bit about having children and working as a cardiologist? Do you feel that you had sufficient maternity leave? How much did you take? Is there more or less available to people who are pregnant now? And really, in a way that if there's someone listening to this who is a young female who has to decide whether she wants to go into cardiology or not, but has concerns about being able to have a family as well, what would you say to them?
Uh, I always tell our younger colleagues that it is definitely doable and it should be part of the plan. Uh, as long as it is something that they want to pursue, a family and children. For me, children came when I felt ready for them, so a little later in life. So my first son was born when I was 37 years old. And I was fortunate to have three kids that I have enjoyed enormously. Uh, I certainly felt, especially comparing notes with colleagues of mine in Europe, back in Europe and Greece, comparing with what we were allowed to have in terms of maternity leave or time off, that the United States were definitely completely different than Europe in terms of having very little maternity leave, very little time after you return to work. So you return to work, and this is it. You're back full time if you have chosen to be full time, with no exception. That was tough. Those were tough years. Certainly for our colleagues who have family and friends around might have been easier. But as you know, for us, without family and friends that would devote time to our families, it was really much harder and much more work. But it can be done. It can certainly be done.
So would you describe it as challenging or hard?
I would say both. I would say both. Challenging is not all necessarily hard, but it was hard at times, and especially with how strict our time is, our free time is when you work full time, and especially at a younger age, when you're expected to really carry on the the heaviest load of work in the lab and the clinic. Um, uh, but it was also positively challenging in terms of after you have done it to feel that I was able to also do this.
And
And I was
worthwhile.
able to go through that and hopefully try to be adequate in every field that I got involved with.
Well, I happen to know that your children have turned out very nicely, so you did a good job. So, so you said it was hard then and challenging, but do you have any regrets for having the three children and for having stayed with cardiology, or is it something that, you've said that you really need to be doing something that you love? So if you love cardiology and you love having children, it would be harder perhaps to have become a dentist and had children because you wouldn't have liked being a dentist as much.
So, first of all, I should start from no matter what I say, if you ask my kids, you will probably hear that I was not as present in their lives as they would have liked to. So that's why I use the word adequate before. So nothing perfect. Never, definitely not the volunteering mom that would chaperone trips and all that. I was the last to know all the names of all the friends and classmates in the school. So certainly. Um, Inadequacies that I don't necessarily feel that I regret. And if I would go back, I would have done things differently because although my kids do complain about how absent sometimes I was, they also feel proud that their mother is a doctor that has been doing things that now are becoming important to them, taking care of patients, healing, uh, offering your help, uh, uh, be somewhere that people would appreciate your presence. After all these years, they are now appreciating that during my absence, I was doing something that for them becomes important as they grow up. Um, so I wouldn't say that, I wouldn't change any of the experience that I had with bringing up my kids. What I might have liked to have, which is something that actually earlier on I had advocated for, to have a schedule that would respect our family lives in addition to our professional lives. And I don't think that that is impossible. I still believe that it can be done. And actually, I'm very hopeful that the newer generation of colleagues, physicians, professionals would be able to guard their professional life or put limits to the professional life so that they can have a more balanced personal and family life as well. And I do see younger generations doing that. Nobody hangs out in the lab after their shift is completed. People just, pack up and get back to their kids as soon as they can. And they speak about their kids, they talk about their needs, they advocate for themselves, which is something that probably when we were at the same age, same state, we were not doing that much because nobody would talk about their kids. Everybody would say about how the work would be done and completed uh, uh, as late as it was in the day without thinking that there were families at home waiting for us to go back home. So I'm hopeful that there will be improvement in the United States, similar to what is happening, I believe, in other countries.
And what are your thoughts on the idea of flexible training?
I haven't thought much about it. Certainly, it has come. I have noticed, especially other programs, fellowship programs, even other specialties offering that to women that want to take time off to have a child or for some family need. But I have not thought a lot about it, so to really offer an opinion, it's definitely something appealing. Definitely appealing. What I have realized after the 25 years of being an attending is that um, there's never absolute crunch of time. Like even if you miss a few weeks, a few months of your professional life, you can, as long as you are planning to return and take it from where you left it, you can always replace that time with training, with knowledge, with experience that maybe you missed during those months that you were away. I think definitely that time can be replaced.
Okay, so in support of the younger women wanting to go into cardiology, what do you think that we as older physicians should be advocating for? Should we be advocating for there to be more physicians doing the same amount of work so that people actually can go home at a reasonable time, or more flexible training, or more maternity leave? What sort of things should we be actually out there trying to get for our juniors?
Um, I believe in people getting together and demanding improvement of their life, professional life, personal life conditions. Uh, some of those demands can definitely be a better definition of work time, of duration of work. If we are supposed to be there for 40 hours per week, have that done. If we work more, have some additional refund for the extra hours. But certainly, I would think, because as we know, the volume of patients keeps going up, the population is getting older, more needs, all the hospitals are crunching for beds and space. And so more shifts, more flexible time schedules during the week. So you don't necessarily work every day from 6:30 or 7 to 7 or 8 or 9 or 10, but alternate schedules. And that, of course, will require more personnel, not only physicians. That would be the same with every category of professionals in the place that we work. And we talked about flexible training that I certainly feel that it's something positive, but I cannot add much more to that.
Mhm. So if you could talk, if you were talking now to a young female wanting to be a cardiologist, what would you advise me if I'm 25 and I've finished medical school, but I'm considering what I want to train in?
Yeah. So I always share my personal experience and how happy I am with what I chose, but it's really very important to choose what you like to do. And I think even after the decision about, let's say, going to cardiology, there are so many different styles between private and academic medicine, between full-time and part-time, between doing a lot of research, no research, little research, that I think it is very important for younger colleagues to really try to decide on all those aspects. The sooner the better. uh, um, you like research. Like I always give them the example that I early on chose clinical cardiology because this is what I love to do, although I do a substantial amount of clinical research, but not basic research. Early on, what told me that this was my calling was that if you had sent me a paper that I needed to review by the end of the night, but at the same time, a patient had called me because they got an ICD shock, I would not even go to the paper. I would just deal with the patient first, review, take care, call, go to the hospital, see the patient. And then reviewing the paper was the second thing that I would do in order of priorities. I know that there are a lot of people that would have looked at the paper first, not necessarily for a life or death situation about the patient, but they would first be so curious to look at the paper and review the paper and get it done, and then take care of a clinical scenario that they would have to attend to. And that tells you something. And I think it is a crude way of deciding how you want, even after you think that you are done because you chose cardiology or electrophysiology, but how you want to spend your time and what would make you happier. And I think the sooner you make these decisions, the better. We do see colleagues, even in their 50s and even beyond, still struggling. Should I just stay with my grants, my research grants, or should I continue to try to combine everything together? And I think the sooner you decide, the better in terms of what makes you happy and more productive.
Okay, so one last question about mentors. So you said earlier that there were various people who were an inspiration to you, and later there were some women who were very supportive of other women. But now they are beginning to introduce in many places this idea of assigning a mentor to a mentee rather than you finding one that's inspiring. So what are your thoughts on this idea of assigned mentors?
So I think that it is definitely a better start than not having anybody that you're allowed, you have been assigned to go and talk to. Um, that person that is assigned to you does not necessarily need to be the mentor that you would be trusting for the rest of your life, but it could be a starting point to be able to have a closer relationship with a more senior person that has some additional experience to a certain degree and give some advice while you are trying to find really the mentor that would be the ideal person for you. Rather than never finding any mentor, I think it's a good start to at least have the person that is assigned to you. And I believe with those assignments, there's always an effort to have a good match between the overall profile of the mentor and the mentee. So I would think that it's only positive.
Okay, great. Well, thank you very much, Dr. Mela. That was lovely. And thank you very much for your time that you've taken out of what I know is a very busy schedule. So,
Dr. Lockwood, thank you for the invitation, and I hope that I see you in person very soon again.
very soon.